So let's get a little more into detail on our classifications of epithelial tissue. Simple squamous, remember, is one layer of flat cells. The cells can be kind of spherical to oval with their nucleus. And this is the thinnest barrier in the body. These are really, really, really thin barriers. And this allows very, very rapid diffusion of molecules across the surface. So we use this in areas like the air sacs in the lungs or in our very smallest blood vessels, what we call the endothelium. And then we also use it to line membranes, or use it in the membranes that line our body cavities called the mesothelium. Simple cuboidal, on the other hand, is a single layer of little cube-shaped cells. They tend to have the nucleus right in the middle of them. And these are really, really good at absorption and secretion. And so we find these especially in our glands. So the thyroid gland, the surface of our ovaries, the walls of the kidney tubules, all have these simple cuboidal epithelial cells. And then simple columnar is a single layer of tall columnar cells. Again, if you can't quite tell how many layers there are, look for the nuclei. Gives you a really good idea. And the simple columnar comes in ciliated or non-ciliated. These are really good for absorption. So the simple columnar, the non-ciliated, will contain microvilli. Now remember, cilia and microvilli look very similar. Microvilli do not move though. Microvilli are there to increase surface area, and so we're going to use simple columnar epithelia, for example, in the intestines. That increases what we call the brush border of the intestines, the surface area dramatically. And that's great because we're trying to absorb nutrients. We can also use non-ciliated in some glands. There's little tiny single cell mucus glands called goblet cells. And then the ciliated simple columnar have the cilia, and these move. So these push stuff along. So we've got some simple columnar epithelial that's ciliated in the bronchioles and in the uterine tubes to help move things past their surface. And then we've got our pseudostratified ciliated columnar epithelia. It's not really stratified, it just sort of looks like it. It's really hard to tell how many layers because the nuclei are scattered all over the place. And the one we're really concerned with is, of course, the ciliated, as I mentioned. So what happens, especially in the upper respiratory system, is that we've got these goblet cells in the trachea and in the larger bronchi, and they produce mucus. And that helps to line the airways and trap material that gets breathed in that we don't want to go into the deep parts of the lungs. Now we've got all this gunky mucus lining our airways, and we need to get rid of it. And so the pseudostratified ciliated columnar epithelial cells are going to push the mucus up. They push it all the way up to the back of the throat, where you then unconsciously swallow most of it. This is called the mucociliary escalator. One of the problems that is encountered when people smoke is the nicotine kind of paralyzes the cilia. And that prevents the normal excavation of the mucus, and so they end up having to cough violently to try and get this gunky mucus out of their lungs, and then they develop what we call a smoker's cough. There's a disease called cystic fibrosis where, because of genetic issues, the cilia are paralyzed forever. They won't move. That and the mucus tends to be a lot thicker than normal. And so these patients are going to have massive respiratory issues, and they literally have the snot beat out of them a couple of times a week. The good thing with the smoking is that if you stop smoking, it takes 3 to 4 days or so to clear your system of all that excess nicotine. But then the cilia all start to function again. If you've ever quit smoking or know somebody who's quit smoking, you can ask them. But about 3 days after they quit, they start coughing up the nastiest black chunky junk as the cilia try to clean up. Our stratified squamous epithelia, I talked about this a little bit in our last video. This is where we're going to have different shapes of cells throughout, but remember, we're only looking at the apical surface for our classification. And at the apex, it's all squamous. So this comes in keratinized and non-keratinized, and we use this a lot in the cutis, in the skin. It's very protective. The keratin is, as I mentioned, a really tough, waterproof protein. And as the cells fill up with the keratin, they stop functioning correctly. That and they are moving further and further away from their supply of vascular oxygen and glucose, and so they start to die. And about a third to halfway up from the surface, the basal surface of the epithelial tissue toward the apex, all the cells are dead. So when you look at your skin, that's all dead tissue. The non-keratinized is still part of the stratified squamous epithelial tissue, but all these cells are alive, and we tend to have the non-keratinized tissue in areas of the body that need protection, but typically aren't very exposed to the outside world. So, for example, parts of the oral cavity, parts of the pharynx, the esophagus, the vagina, and the anus all have this non-keratinized stratified squamous epithelium. Stratified cuboidal is a little less common than other types of tissue in the body. We find it in just a couple types of ducts. A little bit in sweat glands, part of the male urethra. Also, the mammary glands are composed of stratified cuboidal epithelial tissue. And then the stratified columnar is even more rare. We usually only have it in a few places, like the male urethra, or in transitional areas when we're moving from one type of tissue to another type of tissue. Then there's the transitional epithelia that I talked about a little bit before. In a relaxed state, the basal cells are kind of cuboidal and the apical cells are large and round. And then as you stretch it out, those apical cells kind of flatten. So typically when you stretch tissue, it starts to tear. Those desmosomes start to rip and you're going to destroy cells. But in the case of transitional epithelia, the cells stretch dramatically without any kind of damage happening to the tissue. So this allows, for example, the bladder to fill up and not take any damage. So simple epithelia, really good for diffusion, absorption. We can use some of it for secretion. And then stratified is much better for protective functions.